Hi, this is Dr. Binu, consultant obstetrician and laparoscopic gynecologist. I get many patients who ask me, Doctor, is there any remedy other than uterus removal for their bleeding problem or fibroids? So the answer is yes. If you go to your gynecologist at an early stage before you develop severe anemia, there are certain medications and treatments which can get rid of your bleeding problem. First is the hormone treatment. These hormones can be given in form of injections or tablets. You can take these medicines for a duration of 6 months safely if you are nearing your menopause. These medications will get rid of your heavy bleeding problem. Second is the LNG device or the levonorgestrel device, which is commonly available in market in name of Mirena, Emily or Elora. This LNG device, when we put inside the uterine cavity, it reduces the risk of bleeding for almost 5 years. So if you are in your late 30s or 40s and if you have bleeding problem or a heavy pain during menstrual cycle, then if your doctor does a scan and does find that you have endometriosis and adenomyosis or a DUB, you can opt for these options instead of going for a surgical treatment. Then the next available option is endometrial ablation. The endometrial ablation or the radiofrequency endometrial ablation is a short procedure which is done under general anesthesia. Just takes 5 to 10 minutes time and it destroys the endometrial layer. So once the endometrial layer is destroyed, so the female starts getting very less menstrual bleeding or gets totally the menstruation stops. So if you are nearing your menopause, you can opt for this procedure. Then the next option is uterine artery embolization. This uterine artery embolization is done by a interventional radiologist under using fluoroscopy. So using a real-time X-ray, they inject emboli into your uterine arteries, which reduces the risk of bleeding and also reduces the size of fibroids. But if you are trying to conceive of or have a baby, you should definitely not opt for this procedure. So finally, if a woman wants to get pregnant or is anxious to get pregnant and still has a heavy bleeding, what else she can go for, especially if she is having a fibroid. So instead of removing the uterus, definitely we can remove the fibroids, especially using laparoscope or histoscope. So these type of treatments are available, which are takes care of your bleeding, but without removing your uterus. And at last, I just want to say that whatever your issue is, instead of hiding it for a long time, especially the bleeding problems, which generally our women are afraid to tell to their partner or go to the doctor, you should immediately consult a gynecologist and get treatment as soon as possible. Otherwise, your blood loss will be so heavy that one day you may have to get admitted in hospital with severe anemia and undergo a emergency hysterectomy. So if you go to the gynecologist early, there are plenty of medical managements available. Last but not the least, even if you opt for a hysterectomy, example, if your fibroid is really big or if the medical managements have failed, then also there is an option of having a laparoscopic uterus removal. That is through the keyhole instead of getting a classical open surgery done, which will give you a long scar, big scar, and too much of pain. Thank you.